Hello everyone, welcome to this podcast about the TADA algorithm, Skin Cancer Basics. This is Natalia Jaimes and I hope you enjoy it. So the first question we would like to ask is, what does TADA stand for? So TADA stands for Triage Amalgamated Dermoscopic Algorithm. So now that we know what it means, let's break this apart and let's start reviewing the word triage. So triage refers to the sorting out and classification of patients, or in this case, skin lesions, to determine priority of need and proper place of treatment. So in the setting of skin cancer triage, we know that dermoscopy is an important tool that will help us identify lesions that may be suspicious for malignancy, and therefore it will guide our management decision as to whether or not the lesion needs to be biopsied. Therefore, we can see that in this setting, making a specific diagnosis is going to be less important. So, for skin cancer triage, several simplified algorithms have been proposed and are very well known, and here we have some of them. The 3-point checklist, the AC rule, the blue-black rule, chaos and clues, and prediction without pigment. And all of them have their own criteria, their strengths, limitations, and their diagnostic accuracy have been demonstrated in different studies, and all of them prove to work. So based on their strengths and limitation and their key criteria, what TADA did is that took the best of each one of them, their strengths and the key criteria that suggest malignancy, and integrated into one amalgamated triage algorithm. So that's where TADA comes from. So in essence, TADA is a relatively simple, easy to use algorithm that guides in the decision-making process as to whether or not a skin lesion needs to be biopsied. So that's what it's all about, is not missing a skin cancer. Now, in addition, TADA is based on a few important facts. One is based on patterns. Two is that the majority of lesions that we encounter in clinical practice are benign, and we'll see that in the next coming slides. And not surprisingly, since this is a triage algorithm, their sensitivity is high, but also the specificity is good. So here we have TADA algorithm, and overall this algorithm includes a total of 3 steps. And step 1, as we will see, starts with benign lesions. So let's see in more detail what it's all about, using some cases. So the first step is to ask ourselves if the lesion that we are evaluating is an unequivocal dermatofibroma, seborrheic keratosis, or angioma. So in order to do that, we need to know very well the criteria for each one of these lesions. So let us see some examples to go over these criteria in some unequivocal seborrheic keratosis, dermatofibromas, and angiomas. So here we have a seborrheic keratosis demonstrated milia-like cysts, comedonal-like openings, and fissures and ridges. Here we have other 2 cases where we are seeing lesions with well-demarcated borders, ridges and fissures, and comedonal-like openings. Other 2 seborrheic keratosis with milia-like cysts, so don't forget that we need to toggle sometimes between polarized and non-polarized light in order to visualize the milia-like cysts with the non-polarized light. And another seborrheic keratosis. Other examples with dermatofibromas demonstrated the central scar-like area and peripheral fine network. And lastly, few cases of angiomas demonstrating the lacunae separated by septate throughout the lesion. So as we can see, these are unequivocal lesions, and therefore in the first question we would answer yes, these are unequivocal seborrheic keratosis, dermatofibromas, or angiomas, and therefore we don't need to continue using the algorithm, and we reassure the patient or monitor according to the case. Let's see a second case. So let's use the algorithm for this lesion. First, is the lesion an unequivocal dermatofibroma, seborrheic keratosis, or angioma? And the answer is no. It does not reveal any of their criteria. Therefore, we move on to the second step. And here we are asked if the lesion reveals a disorganized pattern. So what is a disorganized pattern? It refers to the symmetry in the distribution of colors or structures. So if we have an asymmetric distribution of colors and structures within the lesion, that lesion will be considered that it has a disorganized pattern. And here we have some examples, and all of them demonstrating a disorganized pattern, and other examples. And we don't need to know the name of the structures to determine if the lesion is disorganized or not. We just need to know if the lesion is organized or disorganized. So in our case, is the lesion disorganized? Yes, it demonstrates a disorganized pattern, and therefore, according to the algorithm, a biopsy will be performed, and this was a basal cell carcinoma. Let's see another case. First question, is this an unequivocal dermatofibroma, seborrheic keratosis, or angioma? And the answer is no, it does not reveal any of their criteria. Therefore, we move to the second step. Is this a disorganized pattern? Yes, the lesion reveals a disorganized pattern, and again, a biopsy is performed, and this demonstrated to be a melanoma in situ. Let's see another case. Small lesion. First question, is this an unequivocal dermatofibroma, seborrheic keratosis, or angioma? And the answer is no. Therefore, we move on to the second step. Does the lesion reveal a disorganized pattern? So some of you may consider this is disorganized and a biopsy will be performed. Others may consider no, the pattern is relatively symmetric. So we move on to the third step. And the third step consists of answering if the lesion demonstrates any of these structures, any of two patterns, like streaks or globules forming a starburst pattern or a negative network, any of two structures including vessels of any type or any morphology or ulceration, or if the lesion reveals any of four colors including blue, black, gray, or white in any structure. So let's see, here are two lesions demonstrating negative network in your left and streaks on your right. Other lesions demonstrating vessels of different morphologies and ulceration, and other cases demonstrating blue, black, gray, and white colors. So coming back to our lesion, does the lesion reveal any of two patterns, two structures, or four colors? And the answer is yes, it reveals vessels, arborizing vessels, and therefore a biopsy is performed and a basal cell carcinoma is demonstrated. Let's see another case. So first question, is this an unequivocal dermatofibroma, seborrheic keratosis, or angioma? The answer is no, it does not reveal any of their criteria. Therefore, we move on to the second step. Does the lesion reveal a disorganized pattern? And the answer is no, it is relatively organized. So we move on to the third step, where we ask if the lesion reveals any of two patterns, two structures, or four colors. And here also the answer is no. Therefore, we reassure the patient this is a benign reticular pattern nevus. And last case. So first question, is this an unequivocal lesion, dermatofibroma, seborrheic keratosis, or angioma? The answer is no, it does not have any of their criteria. So we move on to the second step. Does the lesion reveal a disorganized pattern? So again, for those who think the pattern is disorganized, a skin biopsy will be performed. But let's say the lesion is relatively organized. So we will move on to the third step. Does the lesion reveal any of two patterns, two structures, or four colors? And the answer is yes. So we are seeing a negative network in the lower portion of this lesion. Therefore, according to the algorithm, a skin biopsy will be performed, and this was a melanoma in situ. So with these cases, we demonstrated how TADA is useful for benign and malignant lesions, how it helps us identify those lesions that may be suspicious for skin cancer, and guides our management decision as to whether or not a skin biopsy needs to be performed. And therefore, we achieve our ultimate goal of not missing a skin cancer. And with that, I thank you for your attention, and I hope you enjoy it.